I'm here sitting with Dr. James Simon, and you are?
I'm clinical professor of obstetrics and gynecology at the George Washington University in Washington, D.C., and I'm also the medical director of Women's Health and Research Consultants, an independent research facility also in Washington, D.C.
Now, just a short while ago, I heard Dr. Simon give a really excellent presentation on sexual issues that can happen in midlife. And I wonder if you might comment on some of what you think are the highlights of that discussion.
So it's perfectly natural that women lose some desire, spontaneous interest in sex at midlife. This has been shown in a number of studies. It doesn't mean that it's a desirable change. It's just an inevitable change. We think it may have to do with a decrease in fertility and the hormones related to fertility. And as fertility goes down, spontaneous interest in sex tends to follow. But most women have partners who may be having some issues or decreased interest in sex. And if their changes in interests are in parallel and there's no discord or bothersome nature to those changes, everything's fine. The problem occurs when her interests in sex go down, as I mentioned, an inevitable change of aging in women, but his interests don't. Mm-hmm. And now we have a situation where there's a difference between his and hers, and sometimes that can cause some tension or distress or even concern in a couple's marriage or relationship.
So who would they talk to, or what would they be looking for to get to the bottom of it?
So most women reach first for some kind of supplement or something they get off the internet. And most of those treatments have absolutely no information that's credible to suggest that they work. And I would say further, none of them have been adequately tested to prove that they work. Mm-hmm. She often turns her lack of interest inward, assuming it's her fault or she did something wrong or there's something is medically wrong with her. And that may or may not be true, but depending upon whether she thinks this is a hormonal issue or an aging issue or a psychological issue or a relationship issue, she may seek out different practitioners to satisfy her assumption about what's going on. So if she thinks it's hormones, she may come to me. I'm the endocrinologist, so she may come to me. If she thinks it's a relationship issue, she may choose to go to a couples counselor. If she thinks it's in her head, she may choose to go to a psychologist or a psychiatrist. Regardless, these issues are frequently multifactorial. Even if they're not multifactorial at the beginning, with whatever the underlying cause is, they become multifactorial because people don't have sex in a vacuum. They have sex typically with someone else. So if they've lost interest, yes, it's a problem that they have, but their lack of interest may spill over into their relationship or how their partner approaches them in the sexual arena. So they're always multifactorial, and we have to address them in that fashion.
One thing I would like to ask before we conclude, and that is, many women don't tell their doctors, and many times the doctors don't ask, how big of an issue is that?
It's a tremendous problem. Women fear bringing up sexual problems because they actually are concerned that their practitioner is going to not know the answer. So they're fearing asking a question that their doc doesn't know the answer to. They fear the whole subject. It's taboo in some cultures and in some subgroups to bring up anything related to sex. And finally, most practitioners, including physicians and gynecologists who deal with sex all the time, they don't bring it up because they fear that they're going to embarrass their patient, or it's going to take a really long time to get into the nitty-gritty of the problem, and that's going to set them back in their office for all the patients that follow.
So how many women actually get treated? Of the women, about half of women have this problem.
It's about 40% of women have the problem. About 10% of women have the problem and really need or want some kind of treatment for it. And probably less than half or a quarter of them actually even bring up or have any details about the issue discussed, of which an even smaller percentage do anything to treat it.
So if you haven't thought about this, talk about it so you can do something about it.
Have to bring it up, get it out in the open, talk to your partner about it if possible, talk to your general practitioner about it if possible, talk to a specialist. There are specialists in sexual medicine, both for women, for men, and for couples in most areas, at least most metropolitan areas of the country, and there is help. There's psychological help, there's physical help, and there's mental health help. All of it can be brought to bear to change things and make your sex life better.
Thank you very much.